Dr. Jeff here from Ear Care Specialist. So this question, how do I clean my child's ears? The quick answer is to use a baby wipe just to clean around the ear canal entrance and the pinna itself. So don't ever poke anything down into your child's ear canal. It can risk serious injury and it can push wax against the eardrum itself, making the situation a whole lot worse. I've got quite a few videos on my TikTok just to illustrate this. Now, a couple of things to bear in mind. Firstly, wax isn't a bad thing. It's perfectly natural and healthy to produce earwax. It traps dust and it has antibacterial properties. It also repels water and prevents the ear canal from drying out. So think of it as a protector rather than the enemy. Now, number two, the ears are largely self-cleaning. So wax is produced by glands in the ear canal, usually in the outer third of our ear canal. And the skin which lines our ear canals continually grows laterally outwards away from the eardrum like a conveyor belt. So it pushes the wax out of the ears, and hence why we may see it at the entrance of our ear canals from time to time. So you can take this as a positive sign that the ears are in their self-cleaning mode. Now, if you suspect that your child's ears are completely blocked off with wax and it's affecting their hearing, then go and see your audiologist or an ENT consultant, someone who deals with ears and is actually qualified to do so. And if they confirm that there's a blockage, then wax removal might be necessary. Now, dependent on the age and the temperament of your child, they might be willing to let someone actually remove their earwax. The most important things for the procedure is they need to be still and they need to be calm, and it is a little bit noisy, so they have to tolerate that. Now, usually aged about 5 or 6, after some explanation and a bit of reassurance, possibly sat on their parents' lap or deeply absorbed in Peppa Pig on an iPad, this is usually successful for wax removal. Now, I'd also say that given how physically small children's ear canals are, I would really recommend that the wax is removed under a microscope rather than a head loop. So you don't get very good magnification with a head loop, and a microscope allows for just far better visualization, stronger magnification, and better light as we look down the child's ear. But if your child won't tolerate the procedure, or they're just too frightened, then we could use some oil drops or sodium bicarb drops in the ear. I wouldn't go straight down this route though, not without at least having had it confirmed that the ears are totally blocked off with wax and that the wax looks quite hard. Adding drops into the ear canal will further add to that blocked sensation, so it's worth bearing that in mind. And finally, I would just say that on the extreme end of the spectrum, if the child isn't tolerant of wax removal, but their wax is hard and it's causing hearing loss and pain, then sedation or general anesthetic might be considered. So this is rare, but it can be considered. And this is done via ENT as a sort of last resort. So I hope that was helpful. Thanks for watching.